Hi, I'm Justin Riley. Today on Wisconsin Doctors, the holiday season is fast approaching, which means oftentimes depression and anxiety is a bigger part of people's lives than it typically is. We're going to find out how sleep is related to depression and anxiety here at Wisconsin Doctors. We're on location at Upland Hills Health here in Dodgeville to find out more. I'll be joined by Dr. Rachel Hartline. She's going to be talking about the depression and anxiety end of things. And Sadie Olson from the Sleep Center will talk about how sleep is closely related to mental health. That's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and it's the holiday season, so what better topic to talk about than sleep disorders and mental health? So my first guest joining me today is Dr. Rachel Hartline. Dr. Hartline, welcome back.
Thank you.
Thanks for having us here. Now, I understand that you recently joined the Upland Hills Health team. Tell us a little bit about yourself and where you're serving right now.
Yeah, so I joined Upland Hills in September. I finished my residency this past July in family medicine up in Baraboo, and I kind of wanted to stick around Wisconsin. I'm providing kind of full spectrum family medicine at clinics in Montfort, Highland, and Spring Green, which I'm really excited about.
You're kind of all over the place. And when we last saw you, we were at the Mount Horeb Clinic, which is brand new, just opened up. So that's very cool. So you were a family medicine doctor, and you also provide obstetrics. Tell us a little bit about that.
Yeah, well, it's part of a huge reason of why I chose family medicine. I want to be able to take care of the whole family, including pregnant women. And so I see pregnant women for the duration of their pregnancy. I deliver them. If they need a C-section, I do that as well, and then I can care for the baby. And so it's nice to kind of keep it all in-house and kind of know the backstory on a patient. So
keeping it in-house, I like that.
Yeah.
I like that. And to be able to be with the patient or the woman or the mom through that entire spectrum is really a good thing too. So now we're talking a little bit about mental health today. Why is this such an important topic to you?
Yeah, I feel like mental health is both something that hugely affects our lives and something that we're kind of loath to talk about, particularly in Wisconsin. Your emotions are in the background of everything that's going on, and it's in the background of all your other health problems, whether or not you choose to acknowledge it. But I feel like here we're also kind of in a culture of sort of stoic people who don't want to go to their doctor and talk about their feelings.
Right.
But it takes a toll. Our suicide rate in Iowa County is higher than in other counties, and it's a big deal. And I think that we need to talk about it, need to do something about it, because there are lots of solutions to this problem.
So you talk about the suicide rate. Obviously, depression is a big part of what leads into an early warning sign for suicide and so forth. How common are these issues?
Yeah, so the national kind of prevalence rate for a year, or incidence rate, I guess, the people who in a given year over 18 experience a bout of depression is about 7%, which is, nothing to sneeze at. That's a huge proportion of people. And when you kind of multiply it out over years, probably more people than not in their lifetime are going to experience some form of depression, where their mood kind of stays down and sticks around that way rather than just, kind of a passing mood. So it affects a lot of people just who have the illness themselves, and certainly the people around them and their family and friends have a toll that it takes on them as well.
Yeah, it's a much more serious issue than many of us would probably imagine, and I think that there's probably some truth to the fact that there's probably more people out there with depression who have been diagnosed or who have seen a care provider for something like
certainly.
that. So, yeah.
As you know, Dr. Hartline, I work in the Sleep Disorder Center, and I see a lot of relationship between sleep and sometimes can be associated with depression. what all affects a person's mental health?
Yeah, there are so many things that that kind of are inputs into mental health, and sleep is a big one. If you're not sleeping well, then your brain kind of can't reset itself, and you're just kind of having trouble kind of keeping those emotions regulated. There are a lot of other factors that involve it too, though. Kind of self-care is a big component of things. So making sure you're kind of having good exercise, making sure you're having the appropriate nutrients in your diet, kind of lots of fruits and veggies to sort of keep your brain chemistry kind of well balanced. Those are all important, and then the relationships that you have in your life as well. Those are all important inputs into mental health, in addition to the things that you can't change, like your genes.
So it can be hereditary?
Yeah, it can.
Okay.
And getting a good night's sleep, it's like pushing the reset button.
Yeah, definitely.
Like that. That's very cool. But there really is no sort of silver bullet that can really solve all your problems. It's really the combination of all the things that you do: getting good exercise, good night's sleep, eating well, all of those things. So.
Yeah, there's not a silver bullet, but if I had to hit home on one thing, it would be exercise, because it kind of has so many side effects that are good.
Good positive side effects.
Exactly, yeah.
Well, we got to take a short break. When we come back, we're going to be talking more about how sleep and mental health are closely related. Don't go away. There's more Wisconsin Doctors coming up right after this. And welcome back to Wisconsin Doctors. We've been on location here at Upland Hills Health in Dodgeville, and we've been talking about how mental health and sleep is very, very closely related. And I've been talking with Dr. Rachel Hartline. Dr. Hartline, mental health, depression, anxiety, those types of things, if you have something like that, it's not always as black and white as I've got a broken arm or I've got the flu. So how does one go about recognizing that they may have some sort of mental health problem, and what can be done about it?
Yeah. Well, one of the things I like to do when patients come in is actually use like a scoring rubric to help get a sense of kind of severity and a number to kind of apply to their symptom, whether it's depression or anxiety. But for the patient at home trying to figure out if they need to come in, first of all, you're always welcome. If you're thinking about it, you're more than welcome to come in, and we can help sort that out. You probably have enough things on your mind that it's worth seeing a doctor and kind of talking through those problems. But people use depression and anxiety in kind of a number of different ways. They say like, oh, I'm depressed when something bad happens, but that mood might lift an hour later. Mm-hmm. What I'm worried about is more when that feeling comes and it stays for weeks at a time, where it's happening kind of more days than not, and where it's taking a toll on your ability to function in life in other ways. So if you're noticing that your mood has impacts on your relationship or your ability to work, then that's definitely something that you need to be seen for. And then of course, if you're having any thoughts of hurting yourself or someone else, then that's a reason to come to the doctor.
Right. Having a hard time getting out of bed in the morning, a lot of folks may experience that. That could be a sign.
It can, definitely.
Yeah.
So see your doctor. Are there other things that, where should they start? I mean, the doctor, or do they go to mental health first, or what?
Yeah, I think most family doctors, I would say, feel pretty comfortable with kind of garden variety mental health problems. I definitely put myself in that camp. The family doctor is a good place to start, because we can help sort out, is this something that's rooted in a medical problem? Is your thyroid off? Do you not have enough red blood cells? Those things can make you feel depressed or anxious, depending on kind of the issue. But we can help you sort out, is it something medical? Is it something that's not medical? And then I think most providers are pretty comfortable either referring to psychiatry if that's needed, referring to a therapist if that's needed, or starting some basic medicines kind of that are helpful for the vast majority of people with problems like that.
Okay. What can be done to improve mental health?
Yeah. I like to think about not just kind of treating depression, but building resiliency and building someone's mental health so they don't have those episodes down the line. And there's a lot of inputs into that. There's the genetic things that you can't change. So there's kind of how your brain processes things and the chemicals it sort of naturally makes. You can't fix that one, so we won't talk too much about it. There's your environment. So that's kind of your self-care, your ability to sleep well and kind of be rested when you wake up from sleep, the exercise that you're getting, the relationships that you have, your exposure to the sun. That's another big thing that in the winter is really tough for a lot of us. And your screen time is another kind of component of things. We've kind of seen studies that if men or women are spending more than a couple hours a day in front of the TV, they're much more likely to be depressed. And then kind of last but not least are the factors, again, things that you can't change but then can push you into an episode of depression or anxiety, like life changes, like someone dying or a divorce or things like that. So there's a lot in there that you can change, and a lot of kind of healthy habits you can build to create resiliency and promote mental health.
You know, I've seen, or I've heard at least one other doctor, just family medicine doctor like yourself, say that going to therapy, there's actually no side effects for going to therapy. So he recommends it for everybody. You know, if somebody feels like they need to talk to somebody, it's a good way because there's no side effects.
Yeah, absolutely.
Yeah. Now, it sounds to me, and we just have a couple minutes or a couple seconds left, but it sounds to me like really you know, if you have depression or anxiety, there may not be a cure, but it's manageable.
Yeah.
You know, doing these certain things, it's manageable.
Yeah, definitely. And, you know, for most people, an episode of depression or anxiety might be limited. You know, it might last, you know, we usually treat for 6 months and then take away medicine and see how they're doing, because a lot of times whatever has happened to create that has passed and they're in a new place now and they've kind of rebuilt their brain habits to be in a better place. So it's not something that you'll necessarily need to be on a medicine forever, but it's certainly something that you can need some assistance getting through.
Yeah, absolutely. We got to take another short break here, but when we come back, we're going to be talking more about the relationship between sleep and mental health. It's Wisconsin Doctors. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, Wisconsin, and we've been talking about sleep and mental health. And next I'll be joined by Sadie Olson, who is from the Sleep Center here at Upland Hills Health. Sadie, welcome.
Thank you.
Good to have you with us today. So talk to us a little bit about what the Sleep Center is and what exactly you do there.
Well, the Sleep Center, we've been in existence since about 1998. We're a 2-bed lab. We do all sorts of sleep studies day and night to diagnose sleep disorders. There are over 84 different sleep disorders. So
that's incredible to me. There's 84 different types of sleep disorders.
Not all of them need a sleep study to diagnose,
right.
But we work closely with our medical director, Dr. William Donovan, and we now have a PA, Elizabeth Saar. I'm the lead technologist. My role here is performing sleep studies, working in clinic with our specialists, screening and scheduling the studies, and overall troubleshooting of callers with sleep problems.
It's so interesting that there's so much involved in studying sleep. I mean, who would have thought?
It's becoming more and more, just with more knowledge.
Absolutely.
Yeah. Well, we were just talking about mental health, and of course sleep affects our mental health, but can you tell me some about your perspective on that and how the relationship you see between sleep and mental health? There's
certainly a relationship. There's more and more studies indicating that sleep is very imperative to good mental health. The biggest complaints that we see is overall tiredness and or fatigue, along with insomnia, trouble falling asleep and trouble staying asleep, and that can go hand in hand with mental health disorders. So,
yeah. Now, here's the big $1 million hard-hitting journalism question. Can you tell us how exactly important is a good night's sleep?
I can. I'm going to explain what happens to your brain when you're sleeping. People think that you just shut your eyes and you're unconscious, but the brain is at work when you're asleep. Sleep is very important. We sleep about 1/3 of our life away, and it's for good reason. Think of the body, all the organs and all the cells. They need nutrients and oxygen to function. And in the brain, that's especially critical. The intense electrical activity uses about 1/4 of the body's energy throughout the day and night. Even though the brain only accounts for 2% of the body mass, it uses an extreme amount of energy.
So the brain uses 25% of the energy, even though it's only 2% of the body mass?
Yeah. Okay. Yes. So the circulatory system supplies nutrients to every corner of our body, every cell, including the brain. And as a result, your body has to rid waste.
Yeah.
The body has what's called the lymphatic system to rid waste. Well, guess what? In the brain, no lymphatic system. There's no room up there. So how does the brain rid the waste, and when does it do it?
So the brain has waste even though it doesn't have a lymphatic system?
Yes.
Okay.
So the recent studies have indicated that what actually happens is your brain has cerebral spinal fluid that surrounds the brain.
Sure.
And what happens to rid the waste is that CSF, it infiltrates the brain cells shrink, and the CSF pumps in and out and rids that waste, goes down to the blood, joins up with the blood.
Wow.
And the interesting thing is it's only happening during sleep. So if you'll see, I think we have a screenshot of the brain during wakefulness. There's no cerebral spinal fluid. And then during sleep, that CSF floods the brain, pumps in and out, and flushes the system of it. This is the body's way of ridding the waste. It's kind of like cleaning on the weekends. You don't want to clean during the week, you know?
Right, yeah.
The brain doesn't want to clean while it's awake.
Busy.
Yeah.
Yeah, you don't want to
so
clean
it
when
does
you're
it when you're asleep. So this is an important factor. If you get not good sleep or lack of sleep, your brain is building up some waste and not ridding itself like it needs to.
Yes, yes. And we're going to find out a little bit more about that waste that the brain creates. But first we have to take a short break. We'll be right back with more Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and we've been talking a lot about how sleep and mental health are closely related. And before the break, we learned a little bit about what exactly the brain is doing when we go into sleep. And it's really cool because the brain is actually getting rid of waste products.
Yeah, can you tell us a little bit more about that waste?
Good question.
Yeah, there are many wastes, but one of the key things in this study that they honed in on was amyloid beta. And that really built up, especially in Alzheimer's patients. There have been studies that have found that amyloid beta aggregates and builds up in those cells. So this is one of the key steps or indicators in the development of Alzheimer's. So this is a big thing as a part of this study.
So does this study then suggest that lack of sleep throughout a person's lifetime may be a cause for Alzheimer's?
Not necessarily a cause, but certainly a contributing factor. It changes the way they think about the relationship between sleep and Alzheimer's, though, that's for sure.
Wow, wow.
Yeah.
So it could be one of those things where maybe it is not the cause, but it could bring the onset a little bit sooner than maybe it normally would have had you gotten good sleep your whole life.
It's another thing to think of sleep as preventative medicine
Yes.
for many diseases.
Yeah,
You know.
absolutely.
Yeah. Well, so tell us a little bit about depression and the relationship between sleep and depression.
Well, there are various studies in this relationship. It's pretty complex, like which came first, the chicken or the egg, because
Right.
many people have the symptoms of depression that occur before the sleep problems, but others may have sleep problems first. Sleep problems and depression are kind of similar to where they share risk factors, biological features, and they may respond the same with the same treatment strategies. So I think the important note to take away from that is not to misdiagnose one or the other, not to miss it, and treat both or one or the other appropriately, which is why it's important to talk to your doctor about all of your symptoms. And the other big thing is recognizing we always look at quantity versus quality.
Right.
If you're getting the quantity, now what about the quality, which is where sleep studies come in play.
Right, yeah. Because there have been times when I've had 8 hours of sleep. I go to bed, lights out at 10:30, and then alarm goes off at 6:30, and I still just feel exhausted. But it could be that I just wasn't sleeping, getting the quality of sleep, as you mentioned.
Yeah, and there are many different reasons for that sometimes. Yeah.
I'm going to ask this next question to both of you. What are the most effective ways to treat sleep disorders and depression? Sadie, let's start with you.
So we always first talk to your doctor, but then we get into practice good sleep hygiene. Go to bed at the same time, wake up at the same time, avoid the screen time a couple hours before bed, be in a relaxed setting. The bedroom should be for sleep and sex, and that's it. Cognitive behavior therapy is a good approach to helping insomnia. It's what it is it's aimed at aimed at changing sleep habits and scheduling factors. And it talks about insomnia, and it's weekly or bi-weekly sessions with a clinician who will give you a series of sleep assessments, ask you for a sleep diary, and work with you in sessions to change the way you sleep and the way you view sleep.
I like how you said the bedroom should be for sleep and sex.
Yep.
Because, well, and it's true because so many of us now, I mean, we have our iPads, we have our mobile, it's a second office, and we just find an excuse to get on those things.
And that just wires people.
Yeah, that screen time really can wire people. Dr. Hartline, what about you? What's your take on that?
Yeah, well, I think everything that Sadie said is accurate. And I guess I'll address more of the depression side of things.
Sure.
You know, if you're diagnosed with depression, there's a number of ways we can go about treating you. I harp on exercise because it only has good side effects.
Sure.
And the side effects that and it's as effective as a pill for mild to moderate depression. So it's a really good way to start, and no one's going to be have any downsides from it.
Yeah.
And then the other things are kind of working on changing the chemical soup that your brain sits in that's kind of responsible for that depression. And so one way to go about that is therapy. The cognitive behavioral therapy that she mentioned can be used for depression as well, as to kind of retrain your brain to not kind of have a series of bad thoughts, you know. So if you are not depressed and something bad happens to you, you kind of go about your day. Don't dwell on it. It doesn't kind of bring you down. Mm-hmm. But if you're depressed and say you trip over something, you have this series of negative thoughts, you know, like, why did I do that? You know, I'm a worthless human being. And you need to be able to identify those things and sort of reset your brain's habits so that you don't do that every time. And so that's what that behavioral therapy is set for. And over time, as you do that, your brain chemistry changes. And is kind of back to that more supportive chemical soup. And then the other kind of side of things are medicines. The main category of medicines is selective serotonin reuptake inhibitors, but that's not particularly important. But basically what they do is change the chemical soup so that you can start to change the habit. So it's kind of a chicken and egg thing, and there are people who benefit from both of those solutions. But anyway, there's a lot of different ways to attack it, and there's a solution that's right for you if you're feeling blue.
And I suppose it would depend on how severe that depression is too. That would depend on what type of care you get for it. But
yeah.
I like how you said start with exercise, therapy, and then kind of go to medicine. That seems like a really nice progression of how to do it. So
yeah, absolutely.
Yeah. Dr. Rachel Hartline and Sadie Olson, thank you so much for the information today. This has been a fascinating conversation. If you are feeling depressed, make sure you see your doctor right away. It's easy to get the blues around the holidays. We don't want you to feel that way. That's all for now for Wisconsin Doctors. From all of us here at Upland Hills and CW57, we're inviting you to live longer, live better. We'll see you next time.